Hi, my name is Sean Horwitz and I'm a general surgeon at Murfreesboro Medical Clinic, and today we're going to be talking about the general principles of hernias. A hernia is basically a hole or a defect in your abdominal wall, and your abdominal wall basically keeps all your internal organs where they should be. And basically a hernia is a hole in that structure where something from the inside protrudes, and that can either be fat, which we all have inside our belly, or sometimes even bowel, which can be significantly more dangerous. Hernia forms for two reasons. The first is a congenital defect, and that actually is something that is there from birth. And it could be an umbilical defect, which is basically where your umbilical cord attaches, and there's usually a little space there, and that space usually closes, and in a lot of people it doesn't. And as we get older and bigger and heavier and do more lifting, that hole gets bigger and a hernia forms that way. Very similar for an inguinal hernia as well. The other type of major hernia is kind of an overuse hernia, and that basically is a weakness in your abdominal wall. And over time, you do more lifting, we get heavier, it puts more strain on it, and that weakness actually opens up into a hole, and then a hernia forms that way. So the major types of hernias are an inguinal hernia, which is a hernia down in the groin. Another major type is an umbilical hernia. That's probably the most common one that again happens right around your umbilicus or your belly button. An incisional hernia is a hernia that forms after a surgery, most likely, and that can be anywhere in your abdominal wall. That can be from open surgeries or laparoscopic surgeries. And then a ventral hernia is the last type of hernia, and that's basically a hernia anywhere besides what we actually just discussed. So something besides an umbilical, an inguinal, or an incisional hernia. For different types of hernias, they're more common in men and women. In inguinal hernias, they're actually much more common in men. Femoral hernias, which is an even more rare type of hernia, which we don't see very often, is strangely enough more common in women. And then the other types of hernias, like a ventral, an umbilical, and an incisional hernia, are pretty much equal among both. So in general, heavy lifting can make hernias worse, and this could be basically from daily overuse lifting, where a person just does a lot of lifting throughout the course of their life, or it could be from an extreme lifting activity like lifting a couch or a fridge, or doing very heavy physical activity in terms of a workout or something like that. And that's when you might feel a pop, either in your groin or your abdominal wall, and start to notice a lump and some pain, and that would be the time that you actually give us a call. For our department, you do not have to have a referral. If you feel a lump in your abdominal wall or in your groin, or just something you're not exactly sure of that may or may not be causing pain, you can call our department and just schedule an appointment. You don't have to have a referral through your PCP, so just give us a call.